Okay, good day. So, ito yung topic natin, more on common board questions. Okay?
This is a midwifery reviewer of Excellency Review Center. A patient who is in profound unconscious is answer, coma. In cephalic presentation, breath is at the upper pole. It is determined by what Leopold maneuver? Answer, first grip. If the head is still movable, it is said to be floating. If it is at the level of ischial spine, it is engaged. What LM is used to determine this? Answer, third maneuver. Which vaccine given intradermally? Answer, BCG. Initial number of doses needed for a mother to be protected by tetanus. Answer, 2. Dosage of BCG is, answer, 0.05 ml. Vitamin K dosage and site of administration. Answer, 1 milligram per 0.5 ml bastos lateralis. A mother is experiencing dystocia. What will you do as a midwife? Answer, perform McRoberts maneuver or suprapubic pressure. A mother is having convulsion. What is your priority? Answer, place her outside, lying and protect head. Most affected part of female genitalia with STI. Answer, Bartholin's gland. Okay. Mrs. Manuel, 54 years old, had her menopause 2 years ago. Came to the clinic and complains about vaginal bleeding. What is your appropriate action? Answer, advice for further examination because it is normal. The following drugs are given on the third stage of labor, except nifedipine. Okay? Metergine, ergonometrin, oxytocins are given. Okay, next. A mother came to the clinic complaining about vaginal bleeding, abdominal pain, but the cervix is closed. This is type of abortion. Answer, threatened abortion. Doctor ordered biophysical examination to a pregnant mother and was then diagnosed with absent cardiac activity, is now experiencing bleeding and abdominal cramps. This is misabortion. The following are signs and symptoms of toxemia of pregnancy except hypogastric pain. The signs and symptoms are severe headache, blurring of vision, and epigastric pain. Okay, next. A midwife can repair a perineal laceration because, answer, it is one of her functions according to RA 7392. Okay, depends on the degree. Okay, 17. The presence of a small fluid-filled vesicle in lumps is called genital herpes. Sexually transmitted disease that cause fishy odor. Answer, bacterial vaginosis. STD that has a sign and symptoms of cyst-like discharge. Answer, candidiasis. Cauliflower-like lesions on STI. Answer, condylomata. The following competencies of a midwife during 1 to 3 minutes after delivery, except, okay, this is ENC, Essential Newborn Care. Except cutting the cord after milking towards baby should be avoided. Okay, next. Complainant is also known as plaintiff. A case was filed by Gina against Linda. Gina is the answer, plaintiff, and Linda is the defendant. That someone who told Gina about the incident is answer, witness. What document is the best proof of citizenship when traveling abroad? Answer, passport. Prerequisite of obtaining a passport is answer, birth certificate. A newly registered midwife can apply as a newly. The answer is staff midwife. A midwife can supervise students in hospital given answer, she has 2 years experience or expertise in her area. A midwife educational attainment can be in a criminal case. Okay, aggravating. Next, insanity and mental retardation falls to what circumstances? Answer, exempting. How can you show your loyalty to your patient? Answer, making sure your patient's right respected. PRC Modernization Act. Answer, 8981. What organization will protect the welfare of students? Midwife. Answer, EMAP. Next, a midwife inserted IUD without training is liable for? Answer, malpractice. A person is punished with reclusion perpetua. The person committed a answer, grave felony. What is reclusion perpetua? Answer, life imprisonment. A midwife attended a home delivery, being confident that she or the patient can deliver normally. She didn't bother checking the vital signs. Complications occurred. She is reliable for A. Answer, negligence. A student midwife who adheres to the rules and regulations is said to be answer, well-disciplined. Shape of cervix of a nulliparous. Answer, round or fish mouth. Next, 20 weeks gestation using Bartholomew's rule. Answer, what level? Level of umbilicus. Next, an infant arm becomes red after being accidentally scalded with hot water. What will you do first? Answer, immerse in water. Okay, next. The following competencies of a midwife during postpartum. Keyword, postpartum. Except. Except, answer is calculated EDD and AOG. The answer is assess fundus, monitor vital signs. Okay, next. The following competencies of a midwife during antepartum. Keyword, antepartum. Except. Answer, monitor progress of labor. Activities during antepartum is calculate EDD and AOG, measure fundic height, weight or weigh the mother. Okay, next. In partograph, the following are being assessed. Okay, except effacement. Okay, it should be assessed cervical dilatation, maternal and well-being of the baby. Okay, next. First line antibiotic for pneumonia. Answer, amoxicillin. Second line antibiotic for pneumonia, cotrimoxazole. A mother came to the clinic claiming that her child possessed some proglotins, which is acquired through, answer, orophycal, or through mouth and or hand. Okay, next. In partograph, if plotting passes alert line. Answer. Answer. Monitor the mother intensely. Acquiring this disease suggests lifetime immunity. Answer. Measles. The following are non-communicable disease except, answer, acute respiratory infection. Non-communicable diseases are cardiovascular disease, diabetes, pregnancy-induced hypertension. Okay. A child having cough for 2 months, your appropriate action would be, answer, refer urgently for further examination for asthma and TB. Okay, constipation is caused by what hormone? Answer, progesterone. Best method of contraceptive immediate postpartum. Answer, LAM, lactated amenorrhea method. Tetanus toxoid that gives mother a 3-year protection and a year to the baby. Answer, TT2. The vaccine that gives mother 10 years protection. Answer, TT4. Narrowest AP diameter. Answer, Obstetric. Cardinal movement after descent. Answer, flexion. Okay, memorize edifier area. Okay, next. During IE, distance is measured between the midpoint of sacral promontory and lower margin of symphysis pubis. This is, answer, diagonal. A mother having difficult labor due to shoulder dystocia, action will be, answer, put mother's leg extended to her abdomen. Okay, called McRoberts maneuver. A dark skin pigmentation in mother's face and neck. Answer, chloasma. A reddish purple spots caused by bleeding with the skin. Answer, petechiae. Okay, next. Component of DPT that cause convulsion. Answer, pertussis. Recurrent vaginal infection. What will you advise? Answer, advise mother to undergo glucose testing. Bandage application for jaw. Answer, grabat. Pseudomembrane for dysentery and Koplik spot for measles. Which of the following is an example of aggravating circumstance? Answer, a politician committing homicide. Okay. The following are mitigating circumstances. Midwife who surrendered voluntarily, a politician committed homicide with sufficient provocation, a 17-year-old having abortion. So all of the above is the answer. Alright, next. A child having passed 5 blue stools is irritable. His skin pins goes back slowly and has sunken eyes, is having what dehydration? Answer, some dehydration. A patient delivered and lying in clinic will stay in the clinic for how many hours? A. Answer, 24 hours. Reversible family planning. Answer, condom. Prenatal check-up for how many times? Answer, 4. This family planning is best for postpartum mother. Answer, LUM. Close of posterior fontanelles. Answer, 2 to 3 months. These are the danger signs of pregnancy: blurring of vision, severe headache, epigastric pain, except hypogastric pain. All of the following are objective signs: high fever, bluish discoloration, respiration of 40 to 50, except abdominal pain. Recurring fever for 24 hours. Recurring fever for 24 hours. Answer, intermittent. Recurring fever for several days. Answer, relapsing. Artery that used in infant cardiac arrest. Answer, brachial. What position will you advise to a patient with asthma and cardiac problem? Answer, Fowler's position. PRN means, answer, as needed. Which of the following is placed in the mouth against the mucosa? Answer, buccal. End product of protein in digestion. The answer, amino acids. Nutrients that is or responsible for brain development. Answer, folic acid. Relationship and degree of education is what circumstances? Answer, alternative. What is the route of BCG? Answer, intradermal. Type of micronutrient that is given to a pregnant mother in order to prevent cretinism. Answer, iodine. Washing of perineal wounds. What herbal meds? Answer, guava leaves. In pentavalent, what causes convulsion? Answer, pertussis. After delivery of newborn, the midwife should place the newborn in the abdomen of the mother on what position? Answer, prone position. After delivery of newborn, the first thing that you should do is, answer, immediate thorough drying. In IMCI, these are the following danger signs: convulsion, not able to drink, lethargy, except stridor. Profound unconscious patient is called, answer, comatose. In a 6-month-old infant, how many doses of retinol or vitamin A will you give? Answer, 100,000 IU. Vaccine that are stored at the middle or body of the ref. Answer, pentavalent. How many ml of vitamin K will you give to newborn? Answer, 0.5 ml. Partograph is 4. Okay, answer, either D, B, or C. Okay, progress of labor, fetal well-being, maternal well-being. Meds order that is given at once with specific time. Okay, the answer is single order. Normally, light pink to deep violet color of vagina. Answer, Chadwick sign. Okay, this is Excellency Review Center. Review Center. Okay.
Okay, thank you. Thank you for watching. Please like and subscribe.